here with us today is a breast cancer specialist from Davao City. Hi, Doctor.
Hello, Ina.
Hi. Doc, may tanong lang po kami. Paano nyo nalaman itong product na to?
Well, actually, a family friend of ours visited me in my clinic and introduced transfer factor to me. And at first, every doctor would be hesitant to prescribe a food supplement at that. Kasi natatakot ang mga doktor na baka hindi effective. Until a patient who had recurrent breast cancer came to my clinic. The next option there is not surgery, not radiotherapy, but more expensive chemotherapy. With this option that I gave her, she cried and she said she couldn't afford the very expensive treatment. So I said, oh, why don't you try this product, Transfer Factor? This was introduced to me. And after 1 month, she came back to me in my clinic, and I was amazed with the result. Because of this patient, I became a true believer of Transfer Factor, and I give it to all my patients.
These products are well studied. It's really backed up with good science, and that's why I came to believe this way back in 2009 when it was introduced to me. Though initially I was skeptic, but after reading all the materials, trying to review all the write-ups and the studies, and knowing that the science been there for more than 50 years already. It was just refined, and the biotechnology was only provided by this company, and they come up with a very potent transfer factor, and that's creating the wonders today. This has changed my family. I started it with my family, started with the oldest, my Lola, who is now 89 years old, and not only to my family, to my patients now. And I think the role I have now with For Life is that I have to share this to as many doctors. So we're doing educational forum to the doctors to share to them the science, most especially, and how it can help their patients.
Once fully understood and put to practical application, transfer factor will revolutionize current medical treatments of various diseases. And the advent of transfer factor will mark the beginning of a new approach in the treatment of diseases, which is immunotherapy. Phenomenal ability ng transfer factor lies on its ability, yung kanyang kakayahan i-activate ang cell-mediated immune system.
Ano ibig sabihin nun sa Tagalog?
Kung naniniwala kayo sa bakuna, ang action ng transfer factor ay ang action ng bakuna. Kaya nga lang, ang bakuna, it needs to complete. Kailangan niya ikumpleto ang immune process, which involves several stages. So ibig sabihin, matagal bago niya ma-develop yung cell-mediated immune response. Pero ang transfer factor, it will take you a matter of less than 12 hours to induce yung same na immune response that vaccines are capable of.
Doctora, I understand that you had a personal experience with this transfer factor. So could you share it with our audience kung ano yung nangyari sa inyo?
At first, I'm very skeptical. I was skeptical about it because as a doctor, alam nyo na kung ano na naman niyang ibibigay sa akin na yan. Ano? Sabi ng aking kaibigan, you try it. Doktor sa amin, sa dentist sa aming clinic, sabi, Comadre, you try it. Sabi, kasi nakahusay sa akin, nakagaling sa akin. Sabi ko, nako, ayoko niyan. So, inisnab ko yun nung primero, no? Ngayon, nung hindi na ako makagulapay sa pains, kasi ang aking vertebral column, yung lumbar, 5th and 4th lumbar vertebrae, nag-degenerate. So, naipit yung ugat ko. So, I was in pains, excruciating pain. May sciatica and spondylitis. And sabi ng doktor sa akin, kung hindi maalis ang NSAIDs, no, yung mga steroids, antibiotics, lahat yon, including yung pampatulog na dahil hindi na ako makatulog, ay operahan kita. Sabi gano'n, nako, sabi ko, imagine sa spinal cord yan, no? Baka ako hindi na lalo, maparalyze na ako. And with the 8 operations I had, I'm a survivor, cancer survivor, breast cancer and uterine cancer. At marami akong sakit. May diabetes ako at meron akong hypertension na 3-drug therapy. No? Ngayon, nung napilitan akong inumin ng transfer factor because of desperation, talagang hindi na ako makapag-clinic. Nako, sabi ko, ano na ba itong buhay kong ito? I-wheelchair na ba ako? So, noong inumin ko, siyam agad. Dahil ang binigay sa akin, siyam eh. Ang instruction, take 3 capsules in the morning in an empty stomach, sa tanghali at sa gabi. Eh, out of desperation nga, sabi nila walang overdose kasi milk naman yan, colostrum yan. Ininom ko lahat. And then I wrote a letter, sabi ko, Dear June, yung aking asawa, ang ininom ko ay transfer factor. Sisihin mo ang for life kasi kung ano man ang mangyayari sa akin. So, but the next day, nakabangon ako, still with pain. Pero nabawasan. And I was able to go down from the 3rd floor where I have my house. And then, pumunta ako sa clinic. Dati nakaganyan ako para akong laging isang position lang. Eh ngayon, nakakaikot na ako sa clinic. Sabi ko, tawagin mo yung ano na yan, yung nagkukuha niyan, yung mga nagbibigay niyang transfer factor na yon at gusto ko ituloy. So, I took it since then. Primero, mega dose. Tapos, sumunod, ini-reduce kong dose. Ngayon, 1 capsule na lang in the morning, in the evening. Talaga pala, ang immune system ko lumakas. Yung lahat naman kasi ng condition sa katawan natin na meron talagang inflammation, talagang magaling siya. Talagang, pati diabetes ko na-control, pati hypertension ko na-control, 110/70. Tapos ang aking is only 8. So sabi ko, talagang itutuloy ko ito. And I will recommend it to all my patients. And I even really want doctors, talagang nila ito, subukan as an adjuvant therapy. Hindi mo naman hihinto yung ibang gamot eh. Adjuvant therapy sa mga iniinom na gamot. And nako, talagang magaling.
Ang intriguing fact, reality is, 3 bagay ang nagkokos ng mga karamdaman. Yung viral, bacterial infection, at saka yung immunity disorder. At sa 3 ito, lubhang naging popular ang paggamit ng mga antibiotics, steroids, lahat ng mga yon na in long term ay mas marami ring naibibigay na side effect, bad effects. Ang mga bacteria, pinapatay pati yung mga normal flora sa ating mga sikmura. Kaya ang nagtatribe yung mga fungi, mga ibang virus na nagkokos ng iba pang diseases. Kaya nga doon sa study ng mga sa journal ng American Medical Society, meron silang report na yearly ang death toll nila sa wrong surgery na hindi kailangan, ay maabot ng mga 12,000 a year at mga 106,000 death sa mga related sa mga wrong or negative results of prescriptions. At this time, lumabas ang ating technology ng transfer factor, which is talagang napakabisa upang turuan yung mga immune system natin na nawawala sa landas. Yung mga dapat nilang gawin tulad ng mga killer cells, yung mga natural, mga NK cells, mga ganyan, iba na ang ginagawa. Kaya nagre-resulta ito sa mga sakit. At ang transfer factor, isang maliit na molecule na na-discover ito at naging very, very effective sa ganitong pamamaraan. At maging sa mga sakit sa ating utak, napakagaling po nito.
Sa utak?
Opo. Yung mga